Sure. So Lyme disease is a bacterial infection. It's transmitted by ticks. And this bacteria, Borrelia burgdorferi, is one of several species of bacteria which is found now inside the ticks. And it's making people quite ill. It's been called the great imitator, like syphilis was years ago. And it mimics diseases like chronic fatigue syndrome, fibromyalgia, autoimmune diseases like rheumatoid arthritis, lupus, multiple sclerosis. And the United States, we're experiencing an epidemic of tick-borne diseases now in the US. It's in Europe. It's spread to China and Australia. So we're in the process of seeing this bacterial infection, Lyme disease, spread worldwide. The testing is not very reliable, and many people are getting sick. So it's something really that people need to know about. There's no doubt in my mind this is probably one of the most intelligent bacteria on the planet. In fact, it has 3 times more DNA than any of its closest relatives, which would be chlamydia pneumonia. This organism knows how to evade the immune system. It knows how to hide inside cells. It has decoy mechanisms to protect itself from the immune system. It knows how to shift its outer surface proteins, so it fools the immune system in finding it. It's a very clever bacteria. So there definitely is an intelligence to this bacteria. It's been around for millions of years. They discovered it in amber specimens actually years ago, and in Otzi, who was the Neanderthal man who was found in Tyrolia. So the bacteria has been around for a long time, but I don't think people have recognized the full clinical manifestations of causing fatigue and arthritis and memory problems, yet the bacteria has been around for quite a long time. Well, like any new disease, there are always 2 camps who debate the existence of a disease and how to diagnose and treat it. And in this case, the 2 camps are the Infectious Disease Society of America and ILADS, the International Lyme and Associated Diseases Society, of which I was one of the founding members. So when Lyme was discovered approximately 45 years ago in Lyme, Connecticut by Dr. Alan Steer, he's a rheumatologist and he did an excellent job discovering the bacteria. But he thought because people failed 1 or 2 weeks of antibiotics that it was an autoimmune disease. And then the infectious disease doctors got a hold of it, and there was funding from the NIH that they got on this, and they also felt that it was mainly autoimmune, or they just didn't understand why people stayed chronically ill. So over time, the debate has developed where we now know, in fact, that the blood tests to diagnose this disease are very unreliable. We miss approximately half the patients. It's like a coin flip using the standard test of an ELISA. One of the tests in Europe that's also used in the US called the C6 ELISA, it's a bit better because it also checks for European strains. So there are 100 strains of Lyme disease in the United States and 300 strains worldwide. And in Europe, where you are, Borrelia abzelii and Borrelia guerini are 2 of the major forms of Borrelia that exist in Europe. And abzelii causes a skin rash called acrodermatitis chronicum atropicans. It's a violaceous skin rash of the hands and feet. And Borrelia guerini causes neuroborreliosis, or neurological problems with Lyme. This new test, the C6 ELISA, will pick up these other strains of Lyme. So a lot of the doctors, when they don't find it, they're using an outdated form of an ELISA. It is much better, in my opinion, to use the C6 ELISA and to also use a Western blot with a laboratory that looks at several different strains of Lyme. It's become a taboo subject because there's a political aspect to this disease. It's not just a medical disease. So for example, in the United States, doctors' licenses have been taken away for diagnosing and treating this. Medical boards have come after doctors. Fortunately, in New York State, where I practice, the governor signed a bill about 2 years ago protecting doctors in New York State for diagnosing and treating it. There are other states that have followed. But unfortunately, in Europe, for example, in France, I know doctors who've had their license taken away. And many doctors are scared to treat this disease because European governments and many other governments, Australia, they're using CDC guidelines. And the problem is that the CDC said on their website that Lyme disease is a clinical diagnosis. You're only supposed to use the test for making a clinical diagnosis, but the insurance companies took this definition and they told doctors this was the only way to diagnose it. So many doctors are thrown out of insurance companies for not following the insurance company guidelines. So it is difficult sometimes to diagnose, although I'll explain to you in a bit. There are some easy ways to tell if someone has Lyme. But I think the political situation developed because of the insurance companies, because of funding that was going to certain groups who had a very limited viewpoint. There are conflicts of interest of some of the members of the Infectious Disease Society of America. Some of them do make money from some of the Lyme tests. And they've been getting funds from the NIH for quite a long period of time to hold their same viewpoint, which is that it's an autoimmune phenomenon, there's damage to the body, or we just don't know why people are sick. Except in the middle of a #1 worldwide spreading epidemic, it's just not acceptable to say we don't know why these people are staying ill. I have found in my journey that there are up to 16 reasons why people stay ill with this disease, and I describe it as if someone went to a doctor's office with 16 nails in their foot saying they had foot pain, and if you don't find all the nails, people are going to stay chronically ill. So in 2013, the CDC revised their estimates, and they said that there was a tenfold increase in the number of Lyme cases from 30,000 to over 300,000 cases a year. However, we know that they are not counting the people who have been diagnosed with chronic fatigue syndrome, which is 3.5% of the American population, fibromyalgia, which is 1.5% of the American population. So there alone, you're dealing with millions of people that may have Lyme disease, because the way you make the diagnosis of chronic fatigue and fibro is someone who's tired, they have aches and pains, they have sleep disorders, they have memory problems, and their autonomic nervous system, the part of their nervous system that controls the blood pressure, is thrown off. Well, you see that with chronic fatigue, with fibro, and with Lyme. So the numbers, I think, are grossly underestimated. I suspect there's probably at least 1 to 2 million people a year getting Lyme disease in the United States. The World Health Organization has shown that there's millions of people across, especially Western Europe, that are getting Lyme disease, in the Balkan countries. And we know in China that up to 6% of the Chinese population has had and been exposed to Lyme. And I know that because I met with the head of the CDC in China. The Chinese government invited me over as a consultant and told me privately that those were the numbers, which would mean 6% of 1.4 billion people. You're dealing with 50, 60 million people. You're dealing with huge numbers of people who have Lyme disease. In 2015, the CDC then revised the estimates and said that there was a 320% increase in the number of counties affected in the United States, that it was spreading in all directions. So because the blood tests are unreliable, the ELISA will only pick up approximately half the people. And the fact that the insurance companies have adopted the ELISA followed by a Western blot, which is what the CDC uses to epidemiologically screen large numbers of people, we find that the insurance companies are not really adequately diagnosing these people. And therefore, instead of getting to the source of the illness, they're just allowing their doctors to give these people medication to treat their pain. They may take Aricept patches and Namenda for their memory problems. They may take anti-inflammatory medicines and Neurontin for their neuropathy and their pain, but they're not getting to the underlying source. And I suspect that they think they may be saving money doing this, because the insurance companies at this point are suffering in the United States. Our healthcare system is certainly in disarray at this point. And I think that we do need an overhaul of the way we do practice chronic disease medicine. But I do think the insurance companies, they know there are 2 guidelines for treating Lyme, and they have chosen the guideline that basically says that very few people get this disease and need to be treated. So I think that needs to be addressed from a political issue, and hopefully the 21st Century Cure Act got passed in Congress just this past year. Hopefully we will have better answers for Lyme, which the insurance companies will adapt in the next couple of years. The first time that Lyme was diagnosed was in Europe in the late 1800s. There was a syndrome called Banwarth syndrome, where people would get facial palsy and pain in the face. They didn't recognize at the time, in fact, that this was Lyme disease, but that was one of the first syndromes that was ever diagnosed in Europe in the 1800s. I suspect that probably throughout the centuries, people who came down with unexplained arthritis, unexplained fatigue, early memory and concentration problems, I suspect that this organism, this bacteria, has been around for actually centuries, causing a whole host of clinical manifestations that people just didn't realize. So it's tough to say, but it was first officially recognized in the 1800s, and then in the 1900s, several doctors recognized the erythema migrans rash, and that even started in the 1930s and 40s, where these rashes were being diagnosed. But it really wasn't until Alan Steer in the 1970s was called to Lyme, Connecticut, that they recognized that these children with juvenile rheumatoid arthritis, in fact, had this bacterial organism, Borrelia burgdorferi Lyme disease. That's when really we discovered that it was causing some autoimmune manifestations in these children. And in fact, we now know that Lyme is causing a whole host of autoimmune manifestations. In fact, Dr. Steer just published on it several weeks ago that we do see cases of rheumatoid arthritis, things that look like lupus, when Lyme disease is involved in their case. I think in part, global warming, I do believe, has played a role here. People have moved into wooded areas where they've cut and put their homes right next to wooded areas. The ticks are all now containing multiple co-infections. And what we've seen is, for example, in our area of the Hudson Valley where I practice, that 17 years ago, I was the first doctor to diagnose babesiosis. I had a young woman in a wheelchair who was paralyzed from the waist down for 5 years. She couldn't walk. She had drenching night sweats. And when I treated her babesia, when I found it, within 10 days, she walked for the first time. At that time when we tested the ticks, 2-3% of the ticks contained babesia. 2 years ago, now over 40% of the ticks in our area are now containing babesiosis. So, for example, the viral infections, Powassan encephalitis, it went from 1 to 2% to 5 to 6% in the last several years. Borrelia miyamotoi, which is a relapsing fever Borrelia, it's gone up also several percentage points. So I think that people's habits of where they're living, the fact that there's co-infections, and even environmental toxins that are getting into people, I think are making people sicker, because since the 1950s, we've been dumping thousands of environmental chemicals into the environment, where they're now showing up in many of our patients, and they are making people sick. It's now been linked up to Alzheimer's disease with pesticides showing up in the brains, just as Lyme has now been linked to Alzheimer's disease with other bacteria and viruses. So I think for chronic diseases in the 21st century, one of the paradigm shifts that we need to do is to go from one cause, one disease model, which was called Pasteur's postulate that we all learned in medical school, to a multifactorial model where disease like Alzheimer's, where every 67 seconds someone in the United States gets Alzheimer's, we now know that environmental toxins with bacteria like Lyme disease, viruses like herpes viruses, glucose intolerance with insulin resistance are causing these chronic disease manifestations. So I think we need to now look at not just Lyme, but co-infections, environmental toxins, basically going back to this 16-point model, which I call MSIDS, multiple systemic infectious disease syndrome. I find up to 16 reasons why people stay ill, and 8 out of those 16 cause an inflammatory response. And if you get inflammation, the molecules called cytokines that cause inflammation, tumor necrosis factor alpha, interleukin-1, IL-6, these are all molecules that cause fatigue, headaches, joint pain, memory problems, mood disorders. So that is why we use things like low-dose Naltrexone and certain natural supplements to help take down that inflammatory response in people to get them better, and we found it to be quite effective. There's definitely been an increase in education on Lyme disease. I think a lot more people are aware of it, but what I think has not happened at this point is the public, and many of the public, still believe that the tests are reliable. And I'm about to publish an article in the scientific journals in the next month or two. We validated the questionnaire that's in my new book, How Can I Get Better, in 1,600 people who had Lyme. And we found that this very easy screening questionnaire, if you scored 63 or higher on the questionnaire, you had a high probability of Lyme. The problem is people may go to their doctors and say, I'm tired, I'm achy, and they're told they have chronic fatigue syndrome or fibromyalgia, or they have white spots on an MRI and they're told they have multiple sclerosis, without the doctors actually realizing that Lyme is the great imitator and that these tests are unreliable. So by using a good screening questionnaire and using a laboratory like IGeneX in California that uses 2 strains of Lyme disease, we find that we can find the bacteria and evidence of Borrelia in a lot of these people that have been diagnosed with other diseases. So the education's improving, but I don't think it's anywhere near where it needs to be, because OBGYNs are not telling their pregnant women to be careful because it can be transmitted from a pregnant woman to a child. It is in the blood supply, not so much Lyme disease at this point, but we know that babesiosis, anaplasmosis, Bartonella species, other tick-borne infections are in the blood supply. And I think that the Red Cross may be aware, but I don't think the general public is aware that these bacteria are spreading and causing a lot of chronic illness in people. And I think the doctors need to be educated much more, and that the political situation needs to change, because if we're in the middle of an epidemic and doctors are scared to treat, this epidemic is going to keep spreading. Doctors need to be aware of this disease because it is going to affect the future generations of America. For example, mothers can transmit Lyme disease as well as other tick-borne infections like Babesia, Rocky Mountain spotted fever, Bartonella. These can all be transmitted to the fetus. And I know for a fact that OBGYNs generally are not screening women for Lyme disease and tick-borne disorders before they get pregnant. If they would use the questionnaire that's in my book as a simple screening tool, they would see that these women have a multisystemic illness. They're tired, they're achy, they have a headache. The key to Lyme disease, however, is migratory pain, migratory joint pain, migratory muscle pain, migratory nerve pain. If OBGYNs were to ask these questions, they'd be able to see if a woman about to get pregnant has Lyme, or a psychiatrist who has a patient come in and say, I'm depressed, I'm anxious, I have obsessive compulsive disorder, I'm schizophrenic. Lyme causes every neuropsychiatric manifestation that psychiatrists see. A psychiatrist would want to hand out this questionnaire to see if they have a multisystemic disorder. So because Lyme will affect the heart, the cardiologists need to be looking into it, right? We had a young man in Poughkeepsie years ago who came back from Rhode Island and he had a flu-like illness. The doctor checked him for Lyme. The test was negative and he died 3 weeks later from Lyme carditis. So cardiologists, OBGYN, neurologists, rheumatologists, everyone needs to be educated at this point because Lyme being the great imitator, it affects the brain, it affects the heart, it affects the joints. So it's a very, very serious epidemic. And I think that the insurance companies, they've essentially done a disservice by not saying there are 2 guidelines for diagnosing and treating Lyme, and by only allowing their doctors to use the Infectious Disease Society guidelines, which are 10 years old. They're outdated. They're no longer on the government's website. ILADS redid their guidelines several years ago. They've been used by the Institute of Medicine. They're very high quality guidelines, and they give doctors the ability to diagnose and treat on a clinical basis. So I think the education needs to go way beyond what it is right now, because we talk about Zika virus, we talk about West Nile, but nobody's talking about the dangers of Lyme, which is the #1 vector-borne spreading epidemic across the United States. And the World Health Organization is aware of it. The National Science Foundation has claimed it's one of several pandemics at this point worldwide, with dengue fever, with West Nile, with Zika virus. They're all looking at these viral infections, but Lyme is now included with some of these pandemics that is now spreading worldwide. Right, so the most important questions to ask, and again, I would suggest using the Horowitz MSIDS questionnaire, which we're about to publish, which has been validated. If you gave it in a waiting room while the patient was waiting to see the doctor, even if the doctor had 8 to 10 minutes, the doctor would look at this piece of paper and see that the patient has checked off, let's say, 20 out of 38 symptoms and say that they have a multisystemic disorder. But if they ask the question, do you have good and bad days? Do your symptoms tend to come and go? Do you have a constellation of symptoms? Fatigue, headaches, memory concentration problems, mood disorders, sleep disorders, with specifically migratory joint pain, migratory muscle pain, migratory nerve pain, which could be described as tingling, numbness, burning, or stabbing sensations, where one day the pain is in one joint, 2 days later it's in another. If they ask those questions and then asked women, right around your menstrual cycle, do the symptoms get worse? Because when the estrogen drops off, that's when women get worse. If they were to ask those 5 or 6 basic questions, coming and going, good and bad days, constellation, migratory, worse around hormonal cycles, and then look at a Western blot through a good, reliable lab like IGeneX, which uses 2 strains of Borrelia, you look for what are called Borrelia-specific bands. And there are 5 of them, and I call this Lyme bingo. If you have any one of these 5 bands on a Western blot, bingo, you have been exposed to a Borrelia species. And that is the 23, the outer surface protein C, the 31, the outer surface protein A, the 34, the outer surface protein B, the 39, and the 8393. Any one of those bands shows up, assuming you didn't have the Lyme vaccine or a recent mononucleosis episode. That means that you have been exposed to a Borrelia species, and it's very highly likely that you have been exposed to Borrelia causing Lyme disease, and you need to look into that, as well as co-infections that may be making someone with chronic fatigue or fibromyalgia ill. There's definitely an urgency to diagnose this disease, because if you can get it within the first 30 days, you can cure it. So we know that 75 to 80% of the people, if they happen to see the bullseye rash, and by the way, half of the rashes look like bullseyes, and half of the rashes are solid spreading rashes, but 50% of the people or more, at least in the United States, do not get the rash. But if you do find the rash or see a tick bite and get sick, and you treat it, for example, with doxycycline or Ceftin in the first 30 days, you can cure it. However, those people who are not so lucky, who go past 30 days, those are usually the ones who come to my medical practice, who have long-term problems. They've been to 10 to 20 doctors looking for answers, and by the time they come to see me, many of them are disabled. They have disabling fatigue, memory and concentration problems. The gentleman that I just saw was diagnosed with early Alzheimer's. And we know that, in fact, he has Lyme disease, neurological Lyme, and co-infections like Bartonella that are making him sick. So, the key for these people is definitely there's an urgency for an early diagnosis and treatment. Right. So there's a very simple way to understand the treatment of Lyme disease. The bacteria biologically have been shown to have cell wall forms. They have intracellular forms. They're now being found in biofilms. Biofilms are like the plaque on your teeth when you need to go to the dentist to take the plaque off to get to the bacteria. And they also form cystic forms, which are dormant forms. So if you think about that Lyme has cell wall forms, the drugs you need are cell wall drugs. Those would be penicillins, cephalosporins like Rocephin or Ceftin. But the organisms can change form. So a lot of times when you take a history from someone, they will tell you that some of these drugs, I have a very good response, and sometimes I get worse temporarily, called a Jerax-Herxheimer reaction, meaning you're killing off the bacteria, they temporarily get worse from inflammatory molecules, cytokines being produced. What I do in my practice to get these people better is I look at how these people have responded to prior treatments. So for example, a lot of the Lyme disease that is causing problems with people is inside the cells. It's intracellular. And when we look at a lot of these other bacteria, like Bartonella, rickettsial infections, anaplasma, Ehrlichia, Brucella, tularemia, all of these bacteria exist inside the cells. So what I've done is I've created protocols where we use 2 or 3 and sometimes even 4 intracellular antibiotics like doxycycline, rifampin, and let's say Dapsone, which is the newest drug that I published last year, which is what's called a persister drug. They used Dapsone years ago for leprosy, and they now know from Johns Hopkins University that Lyme disease causes persister cells to form, meaning that a small percentage of these bacteria, when you give a standard antibiotic, will survive the antibiotic, and once you stop it, the bugs will start to grow back. So we have to use persister drugs, which is like Bactrim sulfa drugs or Dapsone, in these protocols. And in the past year, we published the first study on 100 people who used these protocols. And we had the University of New Haven look at these protocols in culture. And what we found is that doxycycline with rifampin, which was affecting biofilms, with Dapsone, within 72 hours, dropped down the load of these biofilm colonies with Borrelia, the most difficult ones to kill. 50% of the bacteria were dead within 72 hours. So right now the problem is that people come in and they're all different. So you have to understand, in a sense, the wiring of an individual. If they get better with doxycycline, doxy goes inside the cells. Zithromax or Biaxin, clarithromycin, goes inside the cells. So does rifampin. You have to take the wiring from the patient and see how they respond, and then you put together regimens that address the cell wall forms, the cystic forms, which would be like Plaquenil, grapefruit seed extract, Flagyl, tinidazole, intracellular forms, biofilms, and persister cells. So what I do is I put combinations of these drugs together based on the testing. Did you test positive for Lyme and other intracellular infections? And how have you responded to these drugs in the past? So for example, the last patient that I saw had no response to Rocephin, which is a very good drug for the central nervous system, but he had evidence of Bartonella. So I gave him minocycline, which goes inside the cells. It hits Lyme and Bart. I gave him mycobutin, rifabutin, which is like rifampin. And then I gave him another drug, levaquin, which goes inside the cell. I gave him 3 intracellular drugs for Lyme and Bartonella because in the past we saw with his wiring he did not respond to cell wall drugs. So the real key here is you have to take a history from the patient and see how every patient individually has reacted to these different protocols. You have to ask if they have day sweats, night sweats, chills, flushing, air hunger, I can't catch my breath. Those are symptoms of babesia, which is a malaria-like organism. So over 90% of the patients I see have this malarial organism, babesia, with Lyme. So if you don't treat the parasites at the same time you treat the Lyme, the people don't get better. So the advantage of the questionnaire that I have developed is that the first question asks the question about the fevers, day sweats, and night sweats. So I can do the testing for babesia, see if I need to treat the parasites. But right now, the treatment, what it's come down to, is you have to look at combinations of hitting the different forms of the organism, using persister drugs, opening up the biofilms, and making sure you're going after the co-infections like Bartonella and like babesia at the same point. If you don't do that, the patients will not completely improve. They may get partial help, but they won't get maximum improvement until you've hit all of these co-infections and the different forms of the bacteria. So it's very important that people follow a sugar-free, yeast-free diet, because when you're giving antibiotics, you can affect an overgrowth of yeast in the colon and also could cause diarrhea. So the first thing we do is we tell people to stay off all sugar. Many of them do well off gluten. You have to check if they have food sensitivities. Because the thing about Lyme disease is the symptoms of Lyme disease are due to inflammation in the body. There are molecules called inflammatory cytokines, TNF-alpha, IL-1, IL-6, interferon gamma. These are the molecules that cause people to be sick with Lyme. If you have food allergies, like if you're sensitive to gluten or if you're allergic to dairy or wheat, you're going to get the same inflammatory molecules produced, just like you do with Lyme. So in the 16-point MSIDS model that I use, 8 out of the 16 points cause inflammation. So these people have to get to sleep. If you don't get to sleep at night, you have too much inflammation. Too much interleukin-6 is produced. If you're eating the wrong foods, right? If you have the wrong bacteria in the microbiome of your gut, you can have inflammation. If you're mineral deficient, like zinc deficiency, will cause increased inflammation in the body. So we give high-dose probiotics, over 300 billion of good quality probiotics with Saccharomyces boulardii to stop C. diff diarrhea. We have people on a regular exercise program, getting them to sleep. And then we use things like low-dose naltrexone. Low-dose naltrexone has been published in the medical literature for multiple sclerosis, for Crohn's disease, for fibromyalgia, and we've used it in over 1,000 people with Lyme, and we find it to be very effective. In fact, my wife is still on LDN after getting over Lyme disease, and she finds it to be very, very useful. The reason LDN works, and the reason we use nutritional supplements with LDN, is LDN will block certain cells in the brain called microglial cells. These are these small glial cells in the brain that cause inflammation. And those are the cells that have been responsible for the manifestations of Alzheimer's disease and other neurodegenerative disorders. They're the same cells that cause inflammation in patients with Lyme disease. So LDN will shut down this microglial proliferation of making cytokines. It helps to shift some of the cytokine formation in the body, so there's less tumor necrosis factor alpha, less interleukin-6. And the way it does this is there is a switch inside the nucleus of the cells called NF-kappa B. So if you can shut off this switch inside your cells called NF-kappa B, which LDN does, and other things that do it, for example, are nutritional supplements like curcumin, green tea extract, broccoli seed extract, resveratrol. These are the 4 supplements that we use with LDN that tell this particular switch inside the nucleus to turn off, shuts down the production of these inflammatory molecules, and people feel tremendously better. So LDN and using these nutritional supplements to help decrease the inflammatory response is part of the regular protocol that we use for people who are chronically ill with Lyme disease. So when I first started my practice 3 decades ago, I thought, I'm going to cure this disease. I'm looking at the biology, and what I found over time is that I was getting the majority of my 12,000 plus people better, but clearly when they were coming off antibiotics, they would relapse. So I started looking at herbal protocols, whether it's traditional Chinese medicine or other herbs, and they do help in about 70%. In the middle of my career, I then said, okay, so the best we're going to do is we're going to use this 16-point MSIDS model. We're going to find co-infections and find all the sources of inflammation. But in the last couple of years, I have now been going back and working on a cure. And the reason that I'm encouraged that a cure may be coming is ever since Johns Hopkins University and Kim Lewis from Northeastern published on Borrelia, Lyme disease causing persister cells, I went to the literature and I said, well, what other persister bacteria are there and how do we treat it? And the model that I used was tuberculosis and leprosy. When we treat TB and leprosy, we have to treat these people for anywhere between 6 to 18 to 24 months. So what I did is I did a study that I published in the medical literature using tuberculosis/leprosy type drugs. And what we found is, because Lyme disease exists inside the cells in persister forms, when we would use other drugs used for other persister bacteria like leprosy TB, we were finding remarkable results. So we're now about to publish our next study on dapsone in 200 people that have used dapsone in combination with doxycycline and rifampin. We look at this combination in people and we find that a large number of people who have failed IV drugs, who have failed standard antibiotics for Lyme disease, they are improving with these persister protocols. But what we don't know at this point is what is the best combination? What is the length of time that they need to be on it? We do know that the highest dose of dapsone that they're on, the better they respond. They need biofilm busters like rifampin, and we don't know at this point, is lauricidin, a coconut oil extract, with biocidin, with stevia. Is it better to combine biofilm busters to open up the biofilms to get the drugs inside? We don't know, but we're working with the University of New Haven and other researchers at this point to look at that, and I'm hopeful in the next couple of years we will have not only culture studies, but a prospective study done through a good university. We're raising monies for it right now. We can look at persister drugs like dapsone, which we're finding to have remarkable success in people who have failed traditional therapies. Sure. So the reason the disease is spreading worldwide is because birds are carrying the ticks. And therefore, and they've shown in Canada that it's been spreading with songbirds. They've shown it throughout Europe. They've shown it in China. So the birds are carrying the ticks to different parts of the world. So for example, in the United States, we recently found some tick-borne infections with rickettsial species like Rocky Mountain with Caribbean type species because the birds are carrying the ticks in these species over here. So we now know that because the birds are spreading it and because it's in the blood supply and because it can be transmitted from a mother to a fetus, we're seeing these other forms. Now, what's not known is whether sexual transmission really can happen or not. Dr. Ray Stricker had published 2 studies with another doctor on possible sexual transmission. The reason I don't think it's very likely at this point is because if you look at the epidemiology of Lyme, we know that it spikes up in the spring, the summer, and the fall, but the rates are low in the wintertime. And we also know for transmission of organisms, we need high amounts of these bacteria. For example, strep throat, it's not enough to have 1 or 2 strep to transmit it. In the vaginal secretions and in the sperm, they've only found 1 or 2 bacteria. Now, is it possible that sexual transmission with the bird spreading it, with the blood supply, is it possible it's contributing? It's possible, but I don't think at this point it's the primary reason why we're seeing the spread. I think the main spread is just happening that these tick-borne infections are being spread by birds, that people have moved into wooded areas, and that when you look inside the ticks, there's more and more bacteria, more and more Lyme disease, relapsing fever Borrelia, Babesia, Anaplasma, viruses. Every year when they check the ticks, there are more and more of these bacteria, parasites, and viruses that are showing up in the ticks. And unfortunately, from a prevention standpoint, I don't think most people know when they go outside hiking and in the woods, you should be putting on spray tick prevention, IR 3535, picaridin, lemon eucalyptus oil, DEET if you're going to be in a very highly endemic area, with permethrin spray on the clothes for prevention. These are things that everyone should be doing at this point for both mosquito-borne diseases as well as tick-borne diseases. So there's an educational perspective. There are children in schools that are still going for walks in the woods with their teachers, where the educational system is not telling the teachers to make sure that these kids are doing prevention before they walk in the woods. Their lives can be destroyed by simply not knowing enough about prevention of tick-borne diseases. So the educational perspective, I think, is going to be very, very important as we move forward. The United States just passed the 21st Century Cure Act. And in the 21st Century Cure Act is a Lyme Bill. And I helped to craft the bill with Congressman Chris Gibson, who's no longer in Congress. This bill now gives $100 million towards Lyme disease research. I was asked by one of our local congressmen to serve on the committee, so I've not yet been officially asked, but hopefully I will be serving. We need to gather a group of scientists, the best and brightest scientists in the world, to come together with researchers, with PhDs, with doctors who've been treating Lyme disease, with patient advocates, with government officials. Everyone needs to get to the table and take a hard look at the science. We need to get past the politics. If you look at the science of Lyme disease, it clearly shows these blood tests are unreliable. It clearly shows that these bacteria are persisting in the body, and they can be responsible from everything from chronic fatigue syndrome to fibromyalgia to multiple sclerosis to people with Alzheimer's disease. So we need to be careful. We have spreading worldwide epidemics. If we don't get groups of scientists governmentally to come together and look at the science and put the politics aside, we're not going to move forward. But fortunately, with this new bill passing in the United States, we have 3 years to come up with a solution. We must come back to Congress in 3 years in the US and say, this is the solution for Lyme disease. We can no longer say, we don't know how to diagnose it and how to treat it. Congress is asking that within 3 years we come up with a solution. And because my new book came out, How Can I Get Better? And I've been working on this for 30 years, I'm hoping that I will get research monies in this next year to take and do a prospective study with some of these new researches that we found on persister drugs, that we will finally be able to solve this epidemic that's spreading worldwide. Lyme disease is the #1 worldwide spreading vector-borne epidemic, in my opinion. It is a pandemic, which has been shown by the National Science Foundation, and it is mimicking a host of other diseases, which are causing suffering worldwide, like chronic fatigue syndrome, fibromyalgia, autoimmune diseases, Alzheimer's disease. So we need to be very, very careful that we improve the testing. There are laboratories working on new tests now for Lyme disease. There are laboratories like Johns Hopkins looking at answers to find out how we can hit these persister bacteria. But we all need to come together, improve the diagnostics, improve the treatment, and stop putting this under the rug, that this is not a problem. We need to shift from it being a political disease to being a medical disease, and really giving it the importance that it deserves for the future generations of our planet.